Hello there. Merry Christmas and a Happy New Year in advance. As you enjoy this Yuletide season, ensure not to lose your guard. Keep family planning at the back of your mind. So we'll be talking briefly about the best contraceptive methods for you. Welcome to Your Health Today with Dr. Yide, where I talk about your health and wellness. I am Dr. Olaide Chinodu. If you're not yet subscribed to this channel, I know you're missing out. Why don't you subscribe right now, yes, and hit that notification bell so you get notifications every time I post new videos. Now straight to the chase.
Birth control methods could be divided into reversible and permanent. We'll delve right into the reversible. Now we'll start with the IUDs, the intrauterine contraceptive devices. There are two types, the non-hormonal and the hormonal. The commonest non-hormonal is the copper T. It's made of copper, as the name implies. Now, how does this bad boy work? It ensures that implantation does not occur within the uterine cavity. It doesn't prevent ovulation, doesn't prevent fertilization. In fact, it doesn't have anything to do with sperms. It just ensures that no pregnancy comes into the uterine cavity. It has a higher incidence of ectopic pregnancies, meaning pregnancies that go to implant outside the uterine cavity. But not to get scared, just a tiny amount of people go through this. So it's not something that has a very high incidence. This copper T can protect a woman for 10 years. Doesn't mean the woman can't get pregnant within 10 years. Once you're ready to get pregnant, you just remove it. It has about a 0.8% failure rate, which is very good, meaning it has a very high success rate. Now the next one is the hormonal IUD. The hormonal IUD has an extra bite of the hormones impregnated into it. This would allow this kind of IUD prevent ovulation, prevent fertilization, and prevent implantation within the uterine cavity. So it's kind of superior to that of the copper T. It has an extra hormonal bite. It has a 0.1 to 0.4% failure rate, which is better than the copper T if you ask me. Now taking us to the hormonal methods. Now the hormonal method employs the use of hormones to regulate ovulation. The essence of using this is you don't want to get pregnant. So we're going to use hormones to prevent that. So these hormones are delivered into the bloodstream via various means. The very first one is the hormonal implants. Now the hormonal implants would be placed into your arm, either the left or the right arm. That's for the woman, not for the man. So this can protect you for a period of 3 to 5 years, depending on the kind you're using. If you're using the implant on, which comes with just one implant, it protects you for 3 years. But if you're using the Jadel, which comes with 2 implants, that can protect you for 5 years. Now, don't forget I said this earlier. This is just telling you how long it can protect you. If you want to get pregnant within 2-3 years, you can have them removed. This has a 0.1% failure rate. Now, the next one is the hormonal shots, hormonal injections. The common one is the Depo-Provera. You ensure you have these injections every 3 months. You mustn't miss any appointment. If you miss it, you stand a chance of getting pregnant. Because once this Depo-Provera expires in your body, your regular fertility cycle resumes. It has a 4% failure rate. We have the combination oral contraceptives and the progestin only. A note of warning. For the combination, meaning it has estrogen and progesterone, if you are 35 years and above and you smoke, you have a family history of breast cancer or blood clotting issues, it is not recommended to use this kind of drug. You can go for the progestin only. Don't go for the combination contraceptive if you fall into the class I just mentioned earlier. They both have a failure rate of 7%. Leading me to the next one, the hormonal patches. Now, the hormonal patches is very, very, very convenient. You don't need expertise to apply this. Just put on the patch. It's pretty simple. It has about 7% failure rate. The last on my list for hormonal methods is the vaginal ring. Now, this vaginal ring releases a certain amount of progestin every day. It is being used for 3 weeks, then removed after 3 weeks to allow for you to flow your normal regular menstrual flow. Then after your menstrual flow, you put another one in again for another 3 weeks. It also has a failure rate of 7%, leading me to the barrier method. Now, the barrier method is a very common one. Some are actually out of date, but I'll still name them all the same. We'll start with the diaphragm or the cervical cap. The diaphragm is not used alone, it's used with spermicides to ensure that any sperm that seeps through the spaces is killed. It prevents sperms from getting to the eggs. That's the essence of this. Another one is the sponge method. The sponge is impregnated with spermicides. Now, this sponge can be worn for 24 hours, but note, you should wait for at least 6 hours after sex to ensure that it actually works. Otherwise, you'll get pregnant. It has a failure rate of 14% in women who have never had a child before, but a 27% failure rate for women who have had a child before. Another method, which is a very common one, is the male condom. A male condom can be efficient between 86 to 98% depending on who is using it and how it's being used. A lot of people have complained about the male condoms that you don't enjoy sex, at times it ruptures. Now, for it to rupture, it means you're not doing the right thing. You're either not wearing it correctly, or you're using oil-based lubricants like olive oil. It's a latex condom. You don't use oil-based lubricants, you use water-based lubricants. Examples are that produced by Durex, by DKT, that's the Fiesta brand, or even KY jelly. Ensure you use a water-based lubricant to prevent breakage or weakness of the latex condom. It has an added advantage of protecting against sexually transmitted infections like HIV, hepatitis B, hepatitis C, gonorrhea, syphilis, and all those sexually transmitted infections. The male condoms are for single use. You don't reuse male condoms. Now, the next on the list here are female condoms. Now, female condoms can be reused, unlike the male condoms. However, it's been reported that it's not as convenient as male condoms. But you know what? You could try it out. You might have a different testimony. The next on my list here are spermicides. Now, spermicides come in various forms. It could be a foam, could be a gel, could be a cream, could be a film, could be a suppository, or could be a tablet for insertion. None of these are oral. Now, the spermicides act just like insecticides. Insecticides killing insects. Spermicides kill sperms. The next method here is the fertility awareness based method. This has about 2 to 23% failure rate depending on who is using it. You need to monitor yourself so that you predict properly, using of a calendar to know when you most likely will ovulate, your basal body temperature, and your cervical mucus. Using these 3 factors would help you predict when you most likely are expected to ovulate. Now, on an average, a woman should have a 9-day fertility period. So you're expected to be fertile within 9 days. It's longer in some people, it's shorter in some people. This tool is very useful. You could use it to get pregnant and use it to avoid pregnancy. If you want to get pregnant, have sex during your fertile period. If you don't want to get pregnant, avoid sex during your fertile period or use any of the barrier methods during your fertile period. The next here is the lactational amenorrhea method. It's expected for a woman who just gave birth not to menstruate. However, this is not cast in stone. For you to use this method, you must have 3 criteria ticked. You must just have given birth, you are not bleeding, you are not menstruating, meaning there's amenorrhea, and you must be breastfeeding exclusively, meaning you breastfeed on demand. You're not regulating it, okay? Because if you don't do that, you sure would get pregnant. Even with that, this is not a very reliable method. So choose what works for you. The next method, Coitus interruptus, or popularly known as the withdrawal method. You need to be careful with the withdrawal method. You can make a deposit without even knowing you've made a deposit, and at the end of the day, you have twins. Well, a lot of people claim that they are very skilled in this. Choose what works for you. Leading me to the emergency contraceptive method. Now, the term emergency, meaning an emergency, it wasn't planned. Emergency contraceptives were actually designed for rape victims, not for just recreational use. We have the pills, and the copper T. Now the pills, a common one is Prostanol. I have seen a lot of people use Prostanol and regret it. You don't use Prostanol recreationally, regularly. It might damage your reproductive career. So it's advisable not to use Prostanol regularly. Another emergency method is the use of copper T. Now, copper T, like I said earlier, prevents implantation from occurring within the uterine cavity. So if you've had unprotected sexual intercourse and you don't want to get pregnant, you can put in the IUCD within a period of 5 days post the act of sexual intercourse. The downside of this is that you need a professional to put it in. You can't put an IUD in yourself. The last kind of method we'll be talking about today are the permanent methods. We have the female sterilization and the male sterilization. The female sterilization is known as the BTL, bilateral tubal ligation, a mouthful. Bilateral stands for both sides, the left and the right. Then the tubes, the fallopian tubes. Ligation just means you're just cutting off or you're tying. So both fallopian tubes are tied to prevent sperms from getting to the eggs. So this woman can't get pregnant. Now note, this is a permanent method. I've come to see a lot of women come to ask me that, doctor, I really want to have one more child, but I have a BTL. Can't you guys sew it back? Can't you reanastomose it? Believe me, if anybody does that for you, they've just predisposed you to a higher risk of ectopic pregnancies due to the scars that would arise from the repair of the already blocked tubes. So it's advisable not to go through with a BTL if you're not sure of completing your family size. Then going straight to the male sterilization method, the vasectomy. The vasectomy is a very simple surgical procedure. You go home that very same day. It entails the cutting or blocking of your tubes, the tubes that conduct sperms from the testes to the penis. Now, a man after vasectomy will still produce semen, but there will be no sperms in it. So it doesn't affect your sexuality, just your mental health, if you allow it. So you need to be very sure that you've completed your family size before you go through with the vasectomy. Now, I'll speak briefly about the possible side effects of these contraceptives. The non-hormonal IUD has a high risk of ectopic pregnancy. You could have excessive bleeding from the use of IUD. You could have a higher risk of spreading PID, pelvic inflammatory disease, especially if there was an infection before the insertion of the IUD. Then the hormonal IUD, just like every hormonal method, has a higher risk of nausea, excessive vaginal bleeding, headaches, irregular or reduced menstrual bleeding, increased breast size or increased tenderness, meaning your breasts might be sore, mood swings, acne, vaginal infection, that if you're using the vaginal ring or the IUD. You could have crampings, which could be very discomforting. If you experience any of these, report to your health professional as soon as possible.
So in summary, there's really no best method for you. You just have to choose what works for you best. Never lose guard. Ensure that you plan your family. It's a very crucial part of your life. Learn the pros and cons and choose what works best for you. If you just love this video, I would have you like, post your comments, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye.